So this is the first time I've ever done this, so I'll be watching along with you. I'm going to talk today about Objective 13, and I'm going to focus on one of the strategies. There are a few strategies in the cancer plan under Objective 13. I'll talk to you about what I know best, the Minnesota Food Charter, and of course Objective 13 of the cancer plan focuses on the prevalence of obesity. You can see on the slide here why we should be concerned, not just about obesity and diet-related chronic disease, but specifically about the connection between what we eat and cancer. We have 3.5 million visits to food shelves. 60% of Minnesotans are at risk of overweight and obesity. And we also know that these statistics are even more compelling in certain communities because we don't have a level playing field when it comes to health, access to healthy food, and diet-related diseases. And so what we have developed in Minnesota is a comprehensive approach that says this isn't about individual behavior change in an individual's choices. It's about creating policy systems and environmental changes that create the kind of environment where the healthy choice is the easy choice. But of course, when it comes to food, it's not just about what's on people's plates. It's an entire complex system from seed to table and then beyond to the waste stream. So if we're talking about making policy and systems changes when it comes to food, we're talking about changing a massive complex system. So we asked ourselves, how do we mobilize thousands of people across the state of Minnesota, help them understand that this is a PSE approach, not an individual behavior change approach, and craft a shared agenda for change that goes from seed to table. And in order to accomplish the implementation of this agenda, how do we build an interconnected web of many, many networks to leverage and push this shared agenda with the ultimate aim of reducing diet-related chronic disease? So we got to work and we organized. We had 150 food charter events across the state of Minnesota. You can see on the left the list of the kinds of stakeholders we had. We had over 2,500 people participate, 400 online submissions, and over 800 individual visits to an online town hall meeting. So out of the thousands of people who participated, we developed the Minnesota Food Charter, which is a shared roadmap of 99 proven policy and systems change strategies designed to be implemented at all scales, from an individual organization to federal farm policy. So that means if you are a decision maker in a division inside a specific organization, if you're a daycare provider, there's a strategy for you. The 99 strategies cover three major areas of our food system: food skills, food environments, and food infrastructure. So like I said, that covers everything from the seed, that infrastructure part, all the way to when people get eating. So when we talk about food skills, we see them as the foundation for healthy eating, and that can include growing and preserving food, preparing healthy options, being willing to try new foods, so anybody who has children knows that that can be a challenge. And then food environments are really about the places where we get food. Do people have enough money for enough healthy food for their families? Is there enough healthy food for all in a given context or community? And how easy is healthy food to get in a person's community or in an organization? And then finally, infrastructure in and of itself is a very complex space, but it includes growing, processing, and distributing not just healthy food, but safe food. It includes ag and food research. It includes labor and pay dimensions, physical and financial infrastructure, and the like. So what the Minnesota Food Charter offers is, first of all, the opportunity to learn. So if you're interested in getting involved, you can go to the website and use the Minnesota Food Charter and a lot of related toolkits and resources to figure out what your options are. Then you can act. You can select one or more of the 99 food charter strategies to implement with partners in your organization, in your region, in your community, in your legislature. And we have a lot of compelling examples of folks who are doing that. And you can share. Did you know there are over 60 local, regional, and issue-specific food and health networks across the state of Minnesota? And not only do we have that many, they are in touch and working together with each other, and they also have access to wonderful capacity-building opportunities. So think about getting involved. And if you get involved, and if we implement the 99 strategies in the Minnesota Food Charter, we have a really powerful solution, which means we'll save $11 billion a year in healthcare costs and generate $2.9 billion a year in economic gains by investing differently in the way we grow, produce, and consume food. So get involved. Visit our website, www.minnesotafoodcharter.com. There's a ton of stuff there. You can meet folks, you can sign up, and follow us on Facebook. Thanks so much.